My parents raised me to be a feminist, and they raised me and my siblings knowing about equality and social justice. And this was something that was really part of my life growing up here in the Philippines. I started Roots of Health in 2009 with my mother and my husband, and we really started it with the primary intention of addressing unplanned teen pregnancy. Teen pregnancy is a problem all over the world, but it's especially so in the Philippines. We have the highest teen pregnancy rate in Southeast Asia, and one of the only countries where that rate has continuously gone up in the last 2 decades. These things aren't being addressed because of the fact that there isn't a priority put on reproductive health. People really need to have access to education and access to services because, for the most part, people haven't had any. And sometimes when we're teaching in schools, the teachers themselves are in the back of the room raising their hands asking questions because it's been generations that don't have any information or education on how to take care of their own bodies and their own health. One of the things that we do is we've partnered with the Department of Education, and we teach in public high schools all over the province. We teach young people about puberty and about reproductive health, as well as about HIV. And we also have a missions program in which the clinical services that we provide in Puerto Princesa within our own office, we bring to other parts of the province, especially to the areas that are considered GIDA areas, so geographically isolated, disadvantaged areas. We bring our nurses and our educators to those places so that even people who usually have no access to that kind of education and to those kinds of high-quality services are able to have them. We have a 23-year-old client who has 4 children already, and she accessed services through our office and decided to get an IUD because she did not want to have any more babies. And afterwards, she came up to me and she told me, "Ate, kung hindi dahil sa inyo, mabubuntis na naman ako, and feeling ko talaga, pag nabuntis ulit ako, baka mamatay ako." And that just really moved me. You know, sometimes we're not even just talking about what a family wants, what a couple wants, what a woman wants for herself and her future children. Sometimes we're really talking about life and death. And that young woman who's only 23 years old with 4 kids really felt that if she went through another pregnancy, she might die. I think that the world has become kind of a scary place. Sometimes it feels like we're taking steps back instead of taking steps forward. It's important to remember that there's a lot of things going on that are really very positive. I think that it's more important than ever to tap the energy and to tap the passion of people who are trying to change things and who are trying to improve the world in their own ways, in their own sectors, and use that to not give up hope and to keep a positive view of the future. My name is Amina Evangelista Swanepoel. I'm the founding executive director of Roots of Health, or Ugat ng Kalusugan, and I'm an Ashoka Fellow.